Hello and welcome to another episode of the FemiNinja Project. And thank you so much for tuning in. I really appreciate it. And as you know by now, on the FemiNinja Project, we are all about alternative health and healing and taking the best care of ourselves that we can so that we can be healthy, vibrant, and do anything and everything we want to do for the rest of our lives. So our guest today is going to help us with that. And she is a fascinating person. Her name is Dale Audrey. She is a registered dental hygienist and oral fitness coach with 40 years experience as an oral care professional and pioneer who has dedicated her career to make her patients' journey in oral care easier and less stressful. And right about now, we can all thank her for that. In 2007, she launched the first natural oral care line developed by a hygienist, earning multiple awards and accolades and impacting hundreds of thousands of people globally achieve better oral health. Well, Dale, thank you so much for being here and welcome to the show.
Well, thank you so much for having me. I'm excited to be here.
I'm so excited too, and especially since we've had a few snafus along the way, so this is really even more exciting. So I love your products. I just want the audience to know that I've tried several of your products. I think they are the best oral care products on the planet. And I really mean this sincerely. So I'm going to just have you take it over and tell us how you got into, dental hygienist and what you found when you got into, the world of dentistry and why you decided to develop your own products.
Well, okay. Well, I'll make a very long story kind of short. But my father was a periodontist. And when I was very young, I would go to his office and help and watch. And what I saw that he did was so barbaric and so crazy that it really affected me. I mean, just to see the amount of blood and pain and things that people went through at that time for him to try to save their teeth at the very end stages. This was, back in the 70s. It was a lot to go through. And it really just affected me. So then when I got older, I finished school, whatnot. And my father said, you should probably be a hygienist. It's a great field for you. So I decided to become a hygienist. And with seeing that picture in my mind, I never wanted anyone to get to that stage, and nobody could understand what I saw, even though I didn't go through it physically. I did go through it. And so I just really had that in the back of my mind and really wanted to make a difference, helping those people not get to that point, and also just becoming very relaxed in the environment, because it's a very stressful environment, dentistry. Nobody really wants to see the dentist and the hygienist as well. But, if the patient is more relaxed, I can do a much better job. And so I just went out of my way totally, because I'm the kind of thinker that I just try to take every negative situation and like reverse it. So I tried to make my patients as comfortable as possible. I didn't like the chemicals in the dental office. I was very against, the radiation. You need radiographs, but the radiation, the chemicals, the Lysol, the everything, the hazmat suits. I mean, I was dressed like, an astronaut. And then I just didn't like that. So I was very interested in learning about natural products. I worked in a natural health food store at the time too. And I just was against the chemicals and all the bad things in dentistry. And I just wanted to reverse it. So in my mind, I just created this. And I actually woke up with a dream one night about creating this establishment that was totally the undental experience, which was my dream. And when I started to approach that years ago, and I was telling people what I wanted to do, because my father had given me an office to go try to do my little, my techniques. Back then, he said it was a great idea, go do it. And I tried, but people didn't understand what I was trying to say. This was like 30 years ago, 40 years ago. So I went back to work, and when I got married, had my children, they went off to college, I developed my first product, which was my natural tooth whitener, which is White Tonight, in 2007. And I said, now's my time. My kids went off to college. I got divorced. I sold my house in Weston, Florida, and I bought a 45-foot motor coach, and I traveled with a friend who left his job, and we just went on the road. We took the little pen and we said, we're going to go. So I knocked on every door everywhere. We tried to get our first big accolade was Whole Foods. And you get in one store, it doesn't mean you're in all the stores at the time, but we get in the region, you have to clear. So from Florida, we started off, and then for 7 years, we went through the whole United States, pounding and selling every day, educating the people in the stores with just that one product, getting in. And then I started to create the rest of the line, because for me, it wasn't all vanity, because it's really, for me, vanity is last, health is first. But I came out with that product first, and then I expanded the line with all the toothpaste and the mouth rinse and whatnot. So that developed as well. And across the country, I went for 7 years, ended up in California, and lived there for quite a while because I got so busy there. And so that's where I stayed for a long time. Then I moved to Denver for a year, because the other part of my dream is to continue and carry on and make these facilities and service people, because products alone won't get rid of your issues. You need to have your teeth cleaned, and you need to have them cleaned on a regular basis, because what forms on your teeth you cannot get off, no matter how good you are at home. So the second part of my dream, or my real dream, is coming into fruition this year. Hopefully we're getting ready to get out and really help the people, just make dentistry more effective, affordable, and more natural. And that's what we're all about.
Wow. Well, kudos to you. And thank you so much for what you're doing.
Sorry.
Because like I said, I wish I, could go back in time like 20 years and, start from there where you're at right now. Because when you're talking about that experience of watching your dad and, in his office, and what the patients are going through with the periodontal disease and all of the things, losing their teeth. I mean, not only is it incredibly painful, it's painful for your mouth, your jaw, but there's also a psychological impact. I mean, there's that aspect of shame. And even going, I have pretty good teeth, but I've gone through a few things over the years. And I often would leave the dentist's office with a sense of shame of, I'm not good enough. I'm not cleaning my teeth enough. I grind my teeth, and that's why I had to have this crown. I mean, it's just so personal.
So personal. Yeah, especially because it's so psychological, because you're sitting down on the chair, and then you're opening your mouth, and you're allowing someone else to actually go into your body. You have to feel comfortable, and the operator has to understand psychologically how they can affect you for your life. Because, if I say something about dentistry, someone will say, oh my God, I was at a dentist when I was 6 years old, and this happened, all these memories come back. It's so important, for both the patient and the operator to be on the right level, it makes a big difference.
And I don't mean to diss on either the dentists or the hygienists or anybody, but I know what it's like, because I'm a medical professional myself.
Right.
And when you're so used to doing certain things, for patients and with patients, to you, it's just another day and it's no big deal. But that patient, it's a very big deal.
Yeah, very big deal.
And it almost feels like, it's very intrusive and invasive. And it's almost like, they always say the eyes are the windows to the soul. It's like the mouth and the teeth are the windows to your health and to your whole innards and your inside.
Exactly. Absolutely.
So explain how our oral health, I mean, everybody knows that they have to brush their teeth, brush and floss, blah, blah, blah. But it's more than that, because if you don't have good oral hygiene and health, it impacts our body in ways that I think people don't realize.
Yeah. In fact, the Mayo Clinic even says if you floss your teeth every day, you can expect to live 7 years longer just from flossing on a daily basis. So the impact is great. And the reason why people don't understand is because it's microscopic. The bacteria in your mouth and the plaque, when we talk about it, we're talking on a microscopic level. You can't really even see it, until it becomes a gross amount of plaque or tartar in your mouth. But it's just that, they find the tracks of plaque in your heart that they find in your mouth, that it's totally linked with, there's so many, they find almost every disease is linked to the bacteria in your mouth. Heart disease, cancer, kidney cancer, Alzheimer's disease. They're finding, COVID, even in COVID, they were finding people that with periodontal disease, weren't able to cure themselves as quickly because of the respiratory issues they were having. So there's just so much that I think people don't realize, that that bacteria in your mouth, it travels through your body. That's how it starts. And that's the important part, is you have to be on top of it, because you're never plaque free. Even after your cleanings, 20 minutes later, your body is going to start to produce the plaque again. People even in comas, they're not plaque free. They produce plaque. Your body produces it, and there's good and bad bacteria. So you have to know, don't kill the bad bacteria with all the chemicals, I mean, all the good bacteria with all the chemicals.
Right.
Need that balance for your microbiome to be healthy. And so that's why I really like using the natural ingredients, because everybody thinks the harder you brush, the better. If you're swishing without mouth rinse and it doesn't burn you, it's not good. So it's all these thoughts that are really not true. So and that's important.
And how barbaric. You said the word earlier, barbaric. And it's, it's almost like self-abuse, but we think it's in like the fitness industry, it's the no pain, no gain.
Right.
And, that's just not the way it works.
No, it's absolutely opposite.
So I really want you to talk about some of the, you're talking about the chemicals and the things that are in, some of the oral care products that we think, oh my goodness, this toothpaste is really good for us because it's got a whitening in it. It's got it's got fluoride, it's got all kind of wonderful things, but you don't really read the fine print and understand what the ingredients are in the toothpaste and some of the other oral care products. And because our mouth is so vascular, and absorbs so quickly and so easily, which is what it's supposed to do. What do some of those chemicals do, and what are some of the ingredients in traditional oral care products that are very harmful for our health?
Right. And I think that's a good point. I mean, I always say to people, like, if people read the ingredients like they do their food, they would never put the toothpaste in their mouth, because it even says if it's harmful if swallowed. I mean, you're going to swallow a little bit of it, even if you're spitting it out, especially for children. So that would be fluoride. Fluoride in high levels is toxic. This is something you're using 2 to 3 times a day, and you're supposed to use only a pea amount of toothpaste. Anyway, it's not like the commercials where they blow it on and you eat, you're eating like a quarter inch of toothpaste every time you brush. But some of the bad chemicals, for instance, would be SLS, sodium lauryl sulfate. This causes canker sores in a lot of people's mouths. They don't even realize it. Sodium lauryl cocolate is like a more natural sodium lauryl sulfate, but it's still a chemical. They say if you can't pronounce the words on the back of your ingredients, then you shouldn't put them in your mouth. Something else is titanium dioxide. That's like a bleach, a white. It makes the toothpaste white, so it looks cleaner. That's like eating white bread. If people eat white bread today, it's like, do you eat white bread? You may not, but it's a bleach that they actually banned already in Europe. They don't use it there anymore. It's still in our toothpaste. What else is there? There's a bunch of things, but I wasn't really prepared. But
no, this is great. This is actually a lot of information, because I think that I'm sure that half of the audience right now is just listening to this with their mouths hanging open, going, "Oh my God, I never knew that," because we don't. I mean, and I laughed when you were talking about the toothpaste. All we need is a pea-sized bit of paste on the toothbrush, and you see the commercials where they get a big slab of well, of course, if you could see that, then your clients or your customers are going to go out and use that same amount of toothpaste on their toothbrush. You sell more product.
Right. And even charcoal based products, I know they're very popular and everybody's out with them, but I don't know if you agree with FDA or not, but FDA is not for charcoal products. And a lot of charcoal products, so they use hard things like coconut shells and things like that are very abrasive to the teeth, and it's really more like a marketing gimmick. So I don't use any products with the charcoal. So it's not, for me, it's not about money. And I was fortunate enough when I worked in a practice that my doctor, if something new and exciting came out, he's like, I'm not going to try this right away. I wait to see what's wrong with it. And then if it still lasts, then I'm going to go out and market it, because it's not all about the money. You know what I'm saying? A lot of people are just jump on the bandwagon, and have those, key buzzwords, but it's not about that. It's about, being ethical and being moral, and just that's what it's about for me anyway. So
And having a very healthy dose of skepticism, I think, is a really
yeah,
good idea
yeah,
too.
exactly.
And if
Yeah,
it's, you
I'm
know,
very
the
pessimistic and I'm very skeptical. If I don't see it or feel it, I will not use it and I will not recommend it, and that's one thing about my brand. I'm a professional and
Mhm,
I have very, very high standards. And that's why I made my own line, because there wasn't anything out there that I really liked, and
mhm,
even Tom's toothpaste at the time, was the most natural, but
mhm.
he still had a lot of chemicals in it, still had a lot of bad things. And now they're owned by Colgate, but they came out as
Mhm.
being natural, so whatever. So,
Well, okay, and we talked about this a little bit before we started recording, but I asked you if once you started developing some of these products, because like I said, I have a lot of experience in the medical field, having 2 different
right.
medical degrees myself. So I suspected that maybe once you started coming out with these products, that maybe they were not embraced, with open arms from the
No.
dental community.
Yeah. In fact, I when I first came out with my first natural tooth whitener, people said, "Why don't you go to the dental offices and sell it?" What I said, "No, my products are professionally professional grade, but they're for the public because I want to make things effective and affordable for them. I didn't want them to go through the dental professionals at the time because, I just wanted to go right to the public because I know I could, and I didn't want them not to be able to afford the products in the beginning.
Mhm,
Um, and that's really why I went out to the public.
mhm.
But what's your question? Sorry, I forgot what
That's
you.
no, that's good. Especially the whitener, because I'm always shocked and appalled when I hear how much they charge for bleach.
Yeah,
And
for what?
oh, I have to thank you for this too. Yes, I did throw out after I tried your whitener. I threw out my little trays that I'd had for several years because I every now and again I would, use the bleach that the dentist sold. And so thank you. It was very liberating. It was almost like burning your bra back in the 60s. Get rid of these
Right.
trays because I just love that whitening product that you have. But everything that I have tried in your product line is so gentle and so effective. And I just feel like my teeth, my mouth, my gums are so much healthier. They're so much cleaner. And I even
Let's,
told you earlier, I felt like, my teeth are doing push-ups.
let's see. Yeah. And I said that's why my company is called Oral Fitness. It's about, you know, going through the same routine for your health as you would
Mhm,
if you work out every morning or if you're putting on your makeup. It's the same
mhm,
steps, it's the same routine. Makeup doesn't, help us for our health, but makes us feel better. But it's those little steps daily. If you do the right things the right way with the right products, you're gonna live a better quality life. And
mhm.
that's what it's all about with our
It
products.
adds up. It's like a cumulative effect.
Mhm. Yeah, absolutely.
So for people who might be experiencing like dental issues right now, and they're listening to this episode, even if you're going through something like that, if you do switch to these natural products, can you reverse some of the damage that has been done already?
Well, first I offer to anyone, they don't even have to purchase anything. Anybody if that goes to our website at www.daleaudrey.com. They can always sign up for a free consultation if they have any questions. I'm always there to help with anything. Dentistry is very confusing.
Mhm,
Mm,
mhm,
My father still gives some advice, but it's all about, feeling comfortable, and I like to help people with the situations that they may have, or recommend something if I know. It depends on the situation. Everybody's so different. Some things can be reversed and some things can't be reversed.
mhm,
Obviously, if it's something at the beginning stage, it's always easier to reverse. Gum disease, there's 5 different stages. And the first stage, gingivitis, which is just inflammation of the gums, that's
mhm,
totally reversible. If you know
mhm,
how to take care of it, it will go back to health. But as it progresses through the stages, they say it's not reversible because then you start to lose fibers and bone, and once the bone is resorbed, it doesn't grow back. So they say, it's not reversible. You can always stop it at different stages and
mhm,
maintain it so it doesn't continue. But
mhm,
for instance, gum disease, cavities is another, issue. people ask me all the time, can cavities be reversed? Now we have this new ingredient, and we put it into our formulas and our oil pulling and our toothpaste, is nanohydroxyapatite. And nanohydroxyapatite, if you're not familiar, is a ingredient that actually a Japanese company came out with. They actually purchased the rights from NASA when the astronauts went into space and they came back. They realized that they lost a lot of the bone density and their teeth demineralized from the atmosphere. So they created nanohydroxyapatite, which is a smaller hydroxyapatite crystal. And we put that in our toothpaste and our mouth rinse. And if you do have cavities that are very small, it's documented that it helps to mineralize these, because your tooth is made of hydroxyapatite also. So it's almost like it bonds like a Band-Aid onto the tooth and helps to mineralize it. And that's something that is excellent, and that we have now on the market. So it's almost like a natural fluoride without the toxicity. So that's something that's really great as well.
So is that ingredient in your mineralizing toothpaste? Because I think there's like 2 different toothpastes, I think, and I got the other one. And I thought, oh, well, I'll be talking to Dale anyway, so I can ask her. Is there an advantage to maybe just having both toothpastes and just alternating, like different days for the mineralization effect, or what? I mean, as a baby boomer,
Right. Well, I think it's always best, since there's no like overdosing or it's not toxic at all. So it's not bad to use the best. It's just price wise, it's a little more expensive. So if somebody wants to start with something and see if they like it or whatever, that's fine. I always like to give people a choice, because everybody's pocket's different. Everybody's situation's different. But the best is obviously with the nano, because it's proven. It's proven.
Okay. Great. Good to know. That brings me to another question that I had, because I know, I don't know if they're still doing this, but it seemed like several years ago, almost everybody I knew was getting this gum surgery for receding teeth or something. I don't really remember, but the only thing I do really remember very clearly is that it was always incredibly painful and it never worked, but they kept doing it. And I remember one time my dentist said, oh, well, you know what, for that one spot, I can refer you to a periodontist and you can have the gum surgery. And I said, no, thanks. I think I'll just, deal with this.
Yeah, well, I don't know. I think I may know what you're talking about, but a lot of people that I hear are being told that they need deep cleanings, which is scaling and root planing, which is under anesthesia. Like if the millimeters in your pockets are 5 millimeters or greater, then the hygienist or dentist might recommend a deep cleaning. I kind of treat a different way, but it's hard to say, because I have to look at the patient. If the patient needs it, the patient needs it, but it shouldn't be like something that all of a sudden everybody needs, you know what I mean? Sometimes that's an insurance thing. Sometimes, unfortunately, in dentistry, a lot of people have HMOs, and then it's a little challenging, because HMOs don't pay for certain things, and if you're not a patient that's paying, sometimes things cost more. But every individual has to be looked at as an individual. That's how I feel.
Isn't that crazy?
I always try to not least invasive, non-surgical. That's it. If you're not, because if you go through surgery, let's say they say you needed it or whatever. If you go through it and you don't know how to take care of it after the surgery, it's going to come back. So the first point of attack for me is always make sure that person understands what it is and what it is to get rid of it. And then if you can't get rid of it that way, you move on to the next step.
And the surgery, I was thinking, it finally came to me. It was like, I think, a skin graft where they would take skin
for
from
recession,
the palate, and then try and graft it over that, and it just sounded absolutely horrible. And for the people I knew who had it done said, yes, it was really horrible, and that the healing wasn't that great either. And I would imagine just because the mouth always moist. And,
Yeah.
I mean, my goodness, we need to be able to eat and drink and talk,
Mhm.
that it would be, not a great
Yeah.
outcome in some cases.
Yeah, and in fact, you have to look at the root cause of the situation. Why do you have gum recession? Some people get gum recession just because their bite is not corrected. So if you go through that surgery, I'm just saying, and your bite is off, and that's why you have recession because you're hitting on the wrong teeth too hard, it's going to come back again. So you really have to understand and not be intimidated to ask questions, because a lot of people are, because it's intimidating to sit in a chair and ask people questions that you don't know what you to even ask. So that's one thing. That's why I'm there to help people. If you have any questions and you just want to know, what does this mean? Or is there something I could do for this? 'Cause you don't always get the right information. Everyone has to be their own doctor. It's even with me. I've gone for situations and in dentistry, and I'll go to 3 different people. They'll tell me 3 different things. I'm like, what's going on here? What's the truth? So, you have to be a little intuitive. You have to understand about it as well. And you have to, make the right decisions for yourself and your pocket too, because not everybody can afford, the textbook, beautiful smile. It's not like that. And I think everyone's smile, on that note, I think everybody's smile is beautiful. And I think people need to live, to really love their mouth. I say their smile is their logo. It doesn't have to be perfectly straight. Everybody's beautiful when they smile. When you don't smile, you're not very attractive, or you don't feel well. But when you smile, your self-esteem goes up, you feel better about yourself, and you light up the world like that. And I think people are a little too hard on themselves sometimes,
Well, thank you so much for saying that, because I think you're absolutely right. And, and you also do get a little bit of a rush of endorphins or whatever when you are
Yeah.
smiling. It's just a much nicer way to go through life. But especially, let's go back to, you even said at the very beginning, when you're opening your mouth, you've got a stranger in there, and it's just
Yeah.
really intrusive. It's so hard then. You're already so intimidated to be able to find your voice and ask pertinent questions. But for the audience, when you're listening to this, remember, you have to educate yourself. Knowledge is power. And if you can walk into a doctor's office, a dentist's office, whomever is your caregiver, with that kind of knowledge and understanding your own body, your own mouth health, you're going to be much better off in the long run. Takes a
Absolutely.
lot of work, but it's definitely well worth it. And if you contact Dale, she can help talk you through it.
Absolutely. Yeah.
Right. So the other one, what was the other thing? Oh yeah, root canals. What do you?
Root canals. Okay. Well, yeah, it's a very controversial topic. A lot of people believe that root canals are not good. But on the flip side, you know, you if you take a tooth out, you're gonna have to replace it. You should replace it, because unless it's like the last tooth in your mouth, and you don't have an opposing tooth on the top, or if you do, the one on the top is gonna come down. But it's like domino effect. If you take out one tooth and it's not replaced, or it's not saved, your whole bite is going to change, and everything is going to most likely move, and it's going to create a lot of other problems. So there's different ways. If you do need a root canal and the nerve is shot, there's if you don't like doing root canals, because that's really like a personal thing, then you would need either an implant, or you need a bridge, or you need a partial. But it needs to be addressed. Everybody's different. It depends on the situation. It depends on the person's insurance a lot of times, and on their pocket, and the way they think. A lot of people don't like root canals, but if it's saving the rest of your mouth, it's doing something good. But you should do something, and sometimes people don't want to do anything, but they need to. If the nerve is bad, you need to treat it in some way. You don't want to leave the tooth in your mouth. That's what I can tell you.
I worked with a woman years ago when I was still working as a respiratory therapist, and anytime she had a problem with one of her teeth, she would tell the dentist, just take it out, just pull
Oh,
it.
yeah.
And I was horrified.
Yeah, that's horrible. That's horrible.
And she says, well, I just don't want to deal with it, and blah blah blah, and it's going to be painful. And I tried to explain to her, and I mean, what did I know? I was a respiratory therapist. I didn't know anything about teeth. And I says, but it's going to affect the rest of your teeth and the rest of your mouth. And she just didn't care.
Yeah, a lot of people don't, and a lot of people say, "Oh, I'll just have them all pulled out and wear dentures." But that doesn't solve your problem, because when you have dentures in your mouth and your bone resorbs, you have to go back and have them relined. Then they don't fit, and then you have to keep going. Then you can't eat. It's not a
Mm,
cure. So
mhm.
the best thing to do is to treat each tooth and keep each tooth. You want to try to keep each tooth because it's worth keeping. Trust me. You
Yes.
don't want to go pulling them out like that. No.
Well, let's talk about chewing. And the reason why I'm asking this, I read a book recently. It's a fabulous book. It's called Breath. And they were talking about like the anthropology of the mouth, the jaw, the skull, and even, into the sinuses and everything. And the
Right.
relationship between like modern teeth and bone structure and chewing. And it's a long involved book, but it's very readable. And he tells a lot of great stories in it as well. But talking about how even our healthy foods nowadays are softer, like, drinking smoothies and avocados, all the really good
Right.
food. There's so much benefit in chewing to
Mhm.
help keep our teeth
Oh yeah.
healthy, our jaw healthy and everything. So if you could address that, that'd be great.
Yeah, because chewing helps to stimulate your gums, and chewing is good for your bones and teeth. That's why God gave us teeth, so we can chew.
Mhm,
I totally get it. If you're on a soft diet, it's not the best for your teeth and gums. It's really
mhm,
not. That's why eating fresh vegetables, carrots, celery, apples, things like that are natural and give you that natural stimulation. That's what you want, because that helps to keep your gums healthy, which helps to keep your teeth in your mouth. Because if your gums aren't healthy, your teeth don't stay in your mouth. And I think a
mhm,
lot of focus is always on the teeth. But my focus is on the gums, because that's what's holding your teeth in at the end of the day.
mhm,
Because if your gums get diseased, you're going to lose your teeth. There's
mhm,
a lot of people are just concerned on how white their teeth are, and
mhm,
that,
mhm,
but that's not the most important thing.
mhm.
The most important thing is your gums. Yeah.
And as a physical therapist, because I'm a PT as well as an RT,
Right,
but as a
right,
physical therapist, my thing is bone, 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 and bone
right,
health. And
right,
especially like you're saying, you need that the chewing to keep the bone healthy. It's the same thing with trying to prevent osteoporosis. If you just sit around and don't do anything, then you're going to
right,
lose bone density.
right,
But if
exactly.
you could lift those weights or do the resistance
Right.
training, then yeah, so it's the
You
same
don't
thing.
use it, you lose it, right?
Bingo, exactly. And that brings me into a nice little segue here of one of your products. I found them
Yeah.
fascinating and I think I might try them. I don't remember the name of them, but they're like little chew sticks.
Oh, the chew sticks, yeah, the Ayurvedic chew sticks, yeah, yeah.
They just look amazing, but I think, if I do get them and I start chewing them, I'll have to wrestle with my dogs because when they see that,
Well,
they'll just
we have them for pets too,
Well,
because
I
they're,
know that. I know
yeah.
you've got a whole pet line, and that's another reason. Like, where have you been? I mean, when I really needed you, because I have a lot of Italian Greyhounds, or I have had in the
Oh, wow.
past, and yeah, they're darling little dogs. They're a little hard to house train, but I actually did a rescue for about 7 years. So
Wow.
all of my dogs were purebred little tiny Italian Greyhounds, and they had the worst teeth on the planet.
Oh, wow.
These
Wow.
dogs, I mean, it's the breed
Yeah.
and the tooth loss and the problems that they
Yeah.
had and
Yeah.
taking them in for dental cleaning. And I did my very best trying to brush their teeth with
Yeah.
doggy tooth. I did everything, but we'd still be losing teeth right and left. But so yeah, you've got the dog products, which of course that's another reason why I wanted to have you on the show because
Yeah.
I'm a dog fan. And you have a product line for kids too.
Yeah. And we are expanding. We're going to be focusing also on more prenatal products,
Mhm,
because it really starts from prenatal. Your
mhm,
gums and the disease in your mouth. If you have gum disease when a woman gives birth, she can have a child with low birth weight because the bacteria passes through the placenta. So it starts, you know, in the womb,
mhm,
with your oral care, and it affects life from the very beginning to the very end of your life. So that's why you want to take care of it as best as you can, extend your life with a good quality life. Chewing, eating the right foods. When you eat the right foods and you're working out and your body is happy, then you live longer. That's
mhm,
basically it. So it affects everybody. I said everybody that has a mouth
mhm.
needs to listen. Everything that has a mouth.
So basically, your oral care and oral hygiene doesn't start after you lose your baby teeth and start getting your adult teeth.
No,
It starts in the womb.
absolutely, absolutely. Education from the beginning all the way. People that lose their teeth and have dentures still have, sores in their mouth, and they still need to take care of their mouth, as like you said, because you understand that your mouth is very vascular. And that's why when you have a heart attack and you have the glycerin tablets, you put them sublingually under your tongue, because in 20 seconds it's in your bloodstream. And that's
Right.
the effect. That's how quick your mouth absorbs things. Also, for pain, when people are in pain, they end up in the emergency room because the nerves in your teeth go straight to your brain. They don't go through your spinal cord. And that's why people they're in excruciating pain when they have a toothache. They're in the emergency room. So your mouth affects you in a big way, very big way, which people may not realize, but it does. It really does.
I absolutely love your passion.
Thank you.
I absolutely love it. So you mentioned this already, and I did see it on your website and in your bio, and I know I'm going to mispronounce it, so I apologize.
Ayurveda.
Thank you. You saw my mouth.
Really?
Yeah. Yes. What is that? And how does it work? I did research it myself, and I did get, of course, conflicting information, which I was thinking to myself, of course.
So Ayurveda is a Eastern Indian philosophy, dates back over 5,000 years ago. And it's really inspiring to me because I love natural products. I love natural ingredients. They're a very disciplined philosophy. They wake up in the morning, they do their rituals. They start with their hot lemon water. They tongue clean right away. They go into oil pulling. So a lot of what I believe in came from what they already do, and I really found it fascinating. And that's Ayurveda. It means the science of life, and it comes back. It's people are going back to Eastern medicine and getting away from Western medicine because they're seeing that they're just coating themselves with prescriptions and things like that. That's not really getting to the root cause per se. People are more interested in natural, much more than ever. I've always been into that, and I've seen it. I've seen the difference in the dental office, and even with my products that I use and will be out this year, knock on wood, with our philosophy and our techniques in natural, that you don't need what you don't need. Our bodies are made to help heal ourselves. I'm not, believe me, if I needed antibiotics, I'm going to take it because I'm medical minded, but I always try to cure myself first with my own body and my own health. And then if need be, I do believe in science. So, so I'm a little of both. And so I really like the Ayurvedic approach and the way they think, their philosophy, but I am, scientific minded, and I will do what's necessary to help myself and others.
You have to have both, and you have to keep it in balance.
Exactly.
And it goes back to educating yourself as well, so you can make the right choices. Or when you're educated, you're empowered, you have this personal information that when you go to a healthcare provider, you can say, this is what's going on, this is what I've tried, this is what I think is working, this is what is not working, this is what I think, then it's more of a collaboration rather than you sitting there in the chair with your mouth open and hoping everything turns out okay.
Right. And what I would just beg people is, do not be afraid of asking questions. Just ask questions. If you don't understand, you need to understand it's you. And a lot of times, some people, I don't want to say a lot of times, but people do make mistakes. Professionals do make mistakes. You need to understand what's going on, and you need to, it's your body. It's your body.
Absolutely. So I want you to briefly talk about the oil pulling, because the rinse and how that works. And this is mostly just to help the audience when they go to your website, so they see these products, then it's like, oh yes, Dale talked about that, so now I know what that is. The tongue cleaning as well as the oil pulling.
Okay, well, the tongue cleaning is really the Ayurvedic approach. You do that first, and I agree with that as well. It's very easy to use. You just put the tongue cleaner in the back of your mouth, stick your tongue out, and kind of scrape like 4 or 5 times, run it underwater. And when it's clean and clear, then you're done, because your tongue is like a sponge and the bacteria stays in there, and you need to clean it. It's part of your body. But a toothbrush doesn't clean as well. People ask all the time. It'll gag you. You can't get back in the back as far as a tongue cleaner. And with the tongue cleaner too, it's stainless steel. You could throw it in the dishwasher even to sterilize it. That's a great way to do it.
Ooh.
The the oil pulling, the oil pulling is comes from Ayurveda, and the Ayurvedics believe swishing with sesame oil, not coconut. Sesame is really the Ayurvedic way. Coconut was a buzz that came later, but they use sesame, and that's our main ingredient. They claim swishing a sesame oil in your mouth for 20 minutes a day will detox your body and pull toxins out. That's where it comes from. But our formula is more modernized. I added herbs and extracts because when I first tried oil pulling, I wasn't even going to make a mouth rinse, because in the office, I never saw a difference with people that used mouth rinse and didn't. But when I tried the oil pulling by itself with just plain oil, I felt better, but it wasn't enough for me, to be honest. So that's why I said, I'm going to create this formula that's better than just plain oil, because I'm scientific minded. And I put things like neem, myrrh, clove, pomegranate extract, and oil of oregano, which are very high in antiseptic, antibacterial properties, and flavored, because I didn't like plain oil the way it tasted. And it is amazing. It helps a lot of people with their pain and moisturizing dry mouth. There's so many good benefits from it. And even if you switch our formula 30 seconds, a minute or two, you're still going to have a benefit, because 20 minutes is a long time. A lot of people don't do it, and a lot of people will do it because they don't want to see the dentist, which was just great. But you can use our formula anywhere from 30 seconds to 2 minutes. So, and that was the first, I created that first to market oil pulling product. So that's from 2010. And it works great.
Yeah, I did try it. I think the longest I went was about 15 minutes, and I was pretty proud of myself. It's like, drool coming down my mouth and everything. But the other thing that I really liked about the oil pulling is, I live in Colorado, of course. It's so dry here all the time that, your skin, your lips, everything, we're just so dry. And after using the oil pulling product, it was like, oh, my lips were so soft and silky, and they were very happy about that. So one other thing that another ingredient that is in, well, a lot of your products, or the ones that I've got, is salt. So if you want to talk about that, about the Himalayan sea salt, I think is mouth rinsed, and I think there's salt in something else, I can't remember. But then I thought, well, of course it is, because even when I was a little girl and we would have sore throats, we used to rinse with warm salt water, and that was the treatment.
Right, and this is what it looks like, the salt one. I have it here. It's Himalayan salt, so it's not like regular table salt. It doesn't raise your blood pressure. It has a lot of trace minerals in it, and it's hand mined, it's pink, and it's been used. It goes back in time also. They used to use it back in the day, salt water. And if you have extractions, the oral surgeon will typically tell you to rinse with warm salt water, 24 hours after a tooth is taken out, because it does help to kill the bacteria, and it's great for sore throats. People that have had COVID, I'm not saying it kills COVID, but people are very, their mouth is feeling so much better after they use it, because it soothes you. The salt soothes you. So that's where that.
And salt is actually one of the ingredients. I told you I make my own laundry detergent. And kosher salt was one of the ingredients. And I thought, well, that does make sense, because, in my profession, when you would get blood on your clothes or whatever, it was like, a little bit of salt, and then boom, lyses the blood cells, and, got a white lab coat again.
Right. I have plenty of it. Yeah.
So Dale, how can the listeners get a hold of you? Because I'm sure that a lot of them have a lot of questions. Where can they get a hold of you?
Well, they can always follow me on Instagram, because I post daily about great little facts and tidbits, tips, and things that they can follow me on at Instagram. It's Dale Audrey, DALE AUD as in David, REY, Dale Audrey, RDH. After that, registered dental hygienist, it stands for RDH. That's the Instagram, at Instagram. And then my website is daleaudrey.com, www.daleaudrey.com. And there they can email and sign up for any complimentary consultations. I'm always there to speak to them whenever.
And if anybody gets a little confused by looking at all the products.
Oh yeah,
'cause
they
it's
can always even, and even on the website, we have a little chat box that we get back to you very quickly about any products that you may have questions about. And we're shipping all over the world now, so we're
amazing.
growing, and we really want to get out to do our service is the next part of it, so we can really literally touch people and help them that way.
Right.
But we are global now, and we're really proud to say that we're the first natural tooth whitener in flight now on some of the airlines, Virgin Airline and El Al and Rwanda Air.
Wow.
Really growing tremendously, and it's important because I just want to help people all over, because dentistry is such a sore subject for so many people, and we need the help. So I'm here for everybody all the time.
Yeah, a sore subject, no pun intended.
Right.
Right. Okay, well, is there anything else you wanted to any like
Oh yeah, so you have a code for the listeners, Ninja 20. Oh, is it 20 Ninja? I don't know if it's Ninja or Ninja 20 now. We created it, but I think it's just Ninja, and 20% off. I'll make sure that's what it is. Your listeners can receive 20% off. We usually put a little gift in anyway for everybody,
Wow.
because we really appreciate everybody, and we're here to make a difference. That's all.
That's amazing. I mean, that's very, very generous. So thank you so much. So, okay, for everybody who's listening and you want to try Dale's products, you have no excuse. If you have any questions, certainly contact her. Obviously, she is a wealth of information. She's obviously very passionate about what she does, and all she wants is to make the world a better place, one smile at a time.
That's right.
All righty. So Dale, thank you so much. Not only for being on the show, for all of the great information, and for being so patient. We had a little bit of a rocky start from a technological standpoint. Yeah, so I really appreciate it. I have been looking forward to talking to you for a very long time. So this has been absolutely great.
Thank you. And I love what you're doing. Keep it up.
Oh, thanks. I don't know any other way.
I hear you.
And everybody, thank you so much for listening. I really appreciate it. Make sure you share this episode with all your friends and family. It can benefit not only anybody who is experiencing dental problems, anybody who doesn't want to experience dental problems. If you know of anybody who's brand new pregnant, get that started, the oral care right from the very beginning. This has just been such a fantastic amount of information, and anything that can help us live longer, be happier, be healthier. You really want to take care of that. And any questions, contact Dale, and she'll help you with anything that you need, all of your oral care. And just remember that every smile is beautiful.
That's true.
And that is the way of the FemiNinja.